How can we help people with Marfan syndrome if they do not know that they're affected? If they have never heard of the condition? If they think that their long arms, their indented chest bone, their curved back are simply a coincidence? It is our duty to spread the word about Marfan syndrome and related disorders so that the general public is informed about the features of the condition, how it is diagnosed, and how it is treated. This knowledge is what will save lives and enhance the lives of those who are affected. Our most effective partner in this endeavor is the media. Through national and local television, radio, magazines, and newspapers, we can bring information about Marfan syndrome and related disorders into homes and workplaces from coast to coast. Parents can learn why their child has dislocated lenses, or why they have grown so much taller than their classmates. Others can connect the dots and now understand and treat the cause of all the medical problems they are experiencing. Still others can learn the real cause of death of a parent or a spouse and can now take care of themselves and their children more effectively so that they can avoid tragedy. Our media coverage always aims to inform and empower. We urge people to take action, to take care of themselves and their family. In the past year, our focus has been on the losartan versus atenolol clinical trial. Only with the participation of 604 people with Marfan syndrome can this research be completed. The first media outlet to recognize the need to help the Marfan community in this patient recruitment process was Women's Day magazine, which reaches more than 4 million people. When editor-in-chief Jane Chesnutt heard about this research, her first reaction was, "How can I help?" The result was a powerful account of the journey of the Dostolik family of Iowa, as told by NMF member Kari Dostolik. She recounted the story of 7-year-old Haley's journey to her Marfan diagnosis and the decision to enroll her in the clinical trial. As a result of this article, many people called and emailed our office and visited our website to find out more. Some people tracked down Kari and contacted her directly. The story gave a timely boost to our trial enrollment efforts. There were a number of other media highlights this year. With the help of our board members and our volunteers, we were able to leverage contacts, resulting in a variety of articles and interviews about Marfan syndrome. We created excitement about national and local events and shared compelling stories of courage. Our most high-profile television coverage was our 4th segment about Marfan syndrome on the Today Show, which highlighted the experience of 7-year-old Brooke Pulliam at last year's annual conference.
You look at her and you say she's tall. I've always been tall. You walk into the room with all the kids with Marfans and you don't feel like you're standing out. You'll blend with the crowd, that's for sure.
The Today Show always moves its viewers to action. This time was no exception, with nearly 10,000 hits to our website following the broadcast. National Public Radio and Sirius Radio also featured lengthy segments on Marfan syndrome. We were in Prevention Magazine and on abcnews.com. We were in newspapers, big and small. We also secured coverage in publications that healthcare professionals read. This ensures that Marfan syndrome and related disorders are top of mind, especially when doctors see a young child with an indented chest bone or a tall patient with unexplained chest pain. We know this is important work. We are reminded every time we hear from someone who is diagnosed because of media coverage. For example, after the Today Show piece aired in November, one mother wrote, "My teenage daughter has many of the symptoms described, but no doctor has ever suggested that they might be related. As a watchful parent, I see that they all fit this puzzle. I am going to have her evaluated." As we work hard to continue our momentum, we thank our members who bravely share their stories, and we salute the media for recognizing the importance of our life-saving message. Together, we are making a difference.